1 million Palestinians have been displaced since the 7th of October. UNRWA sadly had lost 14 staff members who work with the agency in the Gaza Strip since the 7th of October. Many of our own staff themselves, they have been displaced. Many have taken refuge with friends and relatives, but many, many more are taking refuge in UNRWA facilities, including in facilities that were not meant to become shelters. The siege on the Gaza Strip continues. UNRWA has not been able to bring in any supplies since the 7th of October, and our own supplies are running out, and they're running out fast. Our colleagues who continue to be in Gaza, who continue to stay and deliver for people in Gaza, including those impacted by this war, are reporting that they are down themselves to 1 liter of water a day in our offices in the south, where we have relocated our center of operation. They tell us that they cannot even reassure their children, to tell them that it's going to be okay, because maybe it's not going to be okay. We feel that the levels of desperation and frustration and exhaustion among our staff specifically increases by the hour. The longer this goes on, the longer the fatigue, the exhaustion, the frustration. What we are calling for at UNRWA is for the siege to be lifted, the siege on the Gaza Strip to be lifted, so that organizations like UNRWA, but also other sister UN agencies and other humanitarian agencies are able to bring in much needed supplies into the Gaza Strip to provide assistance to those in need. The shelters are overcrowded. The shelters do not have enough sanitation services. We are getting reports that hundreds of people are sharing one toilet, for example. So related to the previous question, we do have serious concerns about the spread of waterborne diseases in the Gaza Strip, especially among those displaced. Many of those displaced are actually UNRWA colleagues, and they tell us that they're shell-shocked. They're shell-shocked simply to lose their home, to become homeless, and to come and take refuge in what is a UN facility, whether it's a school or a logistics center or a medical facility. On the 14 colleagues who were killed, they were, the vast majority of them were teachers. It was a mix of men and women. We had one woman who was a gynecologist. We had one engineer. We had support staff. This is what we have been able to confirm thus far. However, it is likely that the numbers of fallen UN colleagues is higher. Some were killed in their own homes with their families.